thanks everyone for participating this afternoon. I'm Senator Scott Wilk, and I have the honor of representing Sacramento. And our district consists of most of the Santa Clarita Valley, LA County portion of Antelope Valley, and most of the Victor Valley with the exception of Thielen, Pinion Hills, and Barstow. Our town hall, this is the first town hall that we've done, Tele Town Hall. I'm very excited about it, and decided to pick it on mental health and on the science of pandemics. And the reason why I chose this is one of the things I've been doing in between all my meetings is I downloaded in my phone a constituent file, and so I've been trying to spend a little time every day just calling ordinary Californians and talking to them. And there's been a lot of fear, a lot of concern, not only about, what is the science of this, but, concern about their jobs, their family, and what have you. This is near and dear to me. I've had two people that I know that have passed from COVID, and I had two other friends that were hospitalized that recovered and are now at home. And so with that, I was able to entice two experts to come and be with us today, so I'd like to introduce them at this time. And our special guest is Dr. Roger Girion and Dr. Larry Stock, who will provide their expertise and answer some of our questions regarding COVID-19 and how to care for our mental health during these trying times. Dr. Girion is a clinical psychologist on the medical staff of Antelope Valley Hospital in Lancaster, California, the hospital that I was born in. He recently concluded his tenure as the executive director of the mental health at the hospital. Dr. Girion also has expertise in major traumatic events and assisted on-site in New York within one day of the 9/11 attacks. Dr. Stock is the vice chair of the emergency department and chair of Bioethics Committee at Antelope Valley Hospital. Dr. Stock has been involved in international emergency medicine for over 20 years. He volunteered his services in Liberia in 2003 during their last civil war, as well as in 2015 to help during the Ebola crisis. So we are lucky to have these gentlemen here today to answer our questions. Before we start, I want to remind you that the governor's office has an excellent website on all things having to deal with COVID, and that address is www.covid19.ca.gov. With that, we're going to go ahead and jump into questions. Questions were submitted in advance, and so we're going to work through as many as we can. I believe for those that we don't get through, my staff will be able to get back to you and let you and get you an answer. Just one final thing. I burned through my headset, and even though it's a Bose and I spent a lot of money for it, it quit working yesterday. You hear yapping. Those are my two beautiful, cute dogs, which unfortunately it's a beautiful day out. People are walking by, and so they get excited. So with that, let's go in. We're going to start off first with a question from Brenda from Lancaster, and the question is this. This whole COVID virus thing has got me nervous. I'm trying not to freak out. Is this normal? Is there a difference between fear and anxiety? Dr. Girion, you want to take that?
Yes, and Senator, thank you for inviting me to this. It's a very innovative idea. Worry and anxiety are really created in our minds. And we imagine what-if scenarios all the time, and we predict bad things will happen. Anxiety and worry can be controlled. If you look at anxiety as something that is mental as opposed to fear, which is created outside of ourselves usually, if we perceive a threat such as a car coming at us, it is natural to experience fear, and this sets off the fight or flight response. Anxiety can set off the same fight or flight response by simply saying to ourselves, what if a car comes at me? So also many fears are born of fatigue and loneliness and isolation. And so what's happening to a lot of people during this COVID virus isolation, imposed isolation, is that we get stuck with our own negative thoughts. And so it's a real fertile ground for us having catastrophic expectations. So the first thing to do is to learn how to be aware of when it is you're scaring yourself. There's a difference between some external threat scaring us versus something versus our scaring ourselves. Okay? And I hope that helps answer that question.
Okay, great. So let me do a follow-up, because when I think of this event, it kind of reminds me, because I know exactly where I was at when the governor made the announcement, and it kind of reminds me of the second I found out about the 9/11 attacks. So, and I think that's a demarcation point for a lot of people in their lives. So obviously, same thing with young people. So I'm just wondering what you can share in terms of how parents should talk to their children about what's going on.
Well, first of all, I would recommend that we talk to our children openly and honestly, very candidly, and answer questions, share facts about COVID-19 in a way that your children or your teens can understand. It's important to reassure children that they're safe, first of all, and let them know that it's okay if they feel upset. This is a normal reaction to an abnormal situation. You can even share your own concerns, but also let them know that you're in control, that you feel in control. So you can share with them how you deal with stress. And so this gives them a model for them to learn how to cope with it. You should also limit your family's exposure to excessive news coverage. Don't binge watch the news. If you let your children binge watch the news or social media, they're liable to misinterpret or blow out of proportion the potential impact of COVID-19 in their lives. It's also important to help keep regular routines as much as possible and be innovative in terms of some of your new routines. And be a real role model for your kids. Get regular sleep, try to have exercise regularly, eat well, and stay connected with your kids, not just once, but on a regular basis.
Okay, great. Thank you for that. So what we're going to do, I want to toggle back and forth between the science of the pandemic and the mental issues, so we have a flavor throughout the whole program. So Dr. Stock, I'm going to give you an easy one. This is from Julie. I'm not sure where she's from because it doesn't say. Is there some kind of middle ground between being completely wide open, and from your perspective, what would that look like?
Well, good afternoon, Senator, and hello, Dr. Girion. I think that is a great question. We see some of these, I think there's 6 states that have said that they're going to open up today in the south of the U.S., and California, of course, we're still under an emergency order where we're doing our social distancing, and I think people are concerned, because they've been doing this for over a month, and they're wondering, when can I go back to work? Will school open up again for my kids? And what's going to happen with the economy? And if I go out, do I risk getting sick? And so I do think there's a middle road approach that I think is consistent with the governor's outline that he put out, his 6-point plan, but also uses a couple things. It uses science, so we can monitor what's going on with the disease in our communities. We can look at our own personal risk factors, such as our age. Certainly older people are at higher risk. Over 65, it seems to be a marker for where people, if they get sick, they have a higher risk of a bad outcome. People's personal medical histories, if you're perfectly healthy, that lowers your risk. If you have diseases that confer high risk, any organ problem, obesity, immune suppression, those are all risky things. And then your own personal risk tolerance. I think that plays a role as well. But I think there is an approach where we, slowly but progressively, open up for lower risk people and eventually to middle risk people, we sequentially open up bands of risk so that people can start going back to normal life, but maintain those public health habits that we've all learned now about washing our hands keeping our social distance, and reducing, wearing our face masks and that sort of thing to reduce our own risk and the risk of those around us. So I think there is a room for that to happen.
Okay, thank you. So we got questions in advance. I'm actually going to ask you questions that I've been thinking about, and so I apologize in advance for sandbagging you. But I'm just, because I'm interested in the science on this. So if you listen to Governor Newsom and his projections on when the curve is going to be flattened, they don't align with the projections from the CDC or the very well-respected Institute of Health out of the University of Washington. Can you give us some idea why his projections are so much different than the rest of the medical community?
Yeah, I've been looking at the ones from the University of Washington that you've been talking about. So I'm not quite sure where his are different, but I can't say, these are all models, right? And the models have multiple variables, and they're quite complicated. And for instance, before this all started, we were using models that had been used by ProPublica that said, it sort of predicted how many hospital beds, how many ICU beds we would need. And we realized we were nowhere near bedded enough for even a middle case scenario. Well, it turned out of a couple very fortunate things and maybe some smart things, we've had a much better experience here in California than was expected, even for sort of not just the best case scenario, but the middle case scenario. So it turns out we have had enough beds and enough ICU beds in the hospitals, and it turns out we have far fewer cases and deaths than predicted at this point. And part of that is we have a different type of culture, for instance, than what we see in other parts of the country. We have a car culture. We especially here in the Antelope Valley and other parts of your district, we're a little more spread out in our housing. We're not right on top of each other. For the most part, we don't tend to live mostly in apartment buildings, although some of us do. And we actually have followed the public health rules pretty well out here. The other thing is that we closed down, fortunately, by the governor's order early enough relative to when the virus got here that we had far fewer cases. Although I'm sure the virus is here, it spread a lot less than it would have relative to what happened in New York, for instance. So I think these models vary based on the inputs. And but they're all, at the end of the day, they're all trying to tell us pretty much the same thing, that if we don't watch out and we're not careful, we could have another spike.
Yeah, I tell you, it was very sobering. I went over with this woman, Lackey, 3 weeks ago, maybe a little bit more than that, and toured. I think it's the Van Dam Pavilion, where there's 392 beds set up in case there was overflow that the hospitals couldn't handle. And that's, when you walk in there, it was very chilling. And I'm so thankful that we've managed this surge and have not have to do that. Before I go back to Dr. Girion, I'm just going to, because we have a question here from Karen from Palmdale, and you kind of bled into it a little bit. So I'm just going to let you amplify on it. So her question is, what's the difference between what is happening in New York versus L.A., and why have we not had as big a surge as they have in New York? I know you touched on it a little bit. You might as well just go ahead and finish that one off.
Yeah, so in this pandemic, we're learning about this virus every day, and it's fairly, sometimes it takes years to learn stuff that we've learned in months to weeks, and sometimes days in this particular illness. So what we did learn is that days matter. So every day, because the doubling rate of transmission can go up, and we've seen that with cases and with deaths as well. So the fact that we closed a week earlier than New York, and maybe the virus came here a bit later than it did to New York, made a big difference. And so that was one huge thing of the date we decided that we're going to socially isolate and shelter at home. The second is, again, how we live out here is a bit different than for instance, the Antelope Valley is very different than New York City, right? We don't live right on top of each other. We're spread out. Our houses are spread out for the most part. We got a lot of land out here. And the fact that we get around in cars instead of subways and trains makes a big difference. So it may also be people are a bit healthier in California overall than in parts of New York. So all those factors make a difference about their experience. They did an antibody study out there. 22% of people in New York City have antibodies. They had the disease, and whether or not they were sick. And out here, the study that was out here was somewhere between 2 and 4%. The one that was done at USC. We just have not had the same experience for all those variables.
So I have a follow-up question because I believe in local. If you look at the data, LA County is a hot spot, but I would submit that Antelope Valley, for all the reasons you already laid out, is much different than the rest of LA County. When we go to relaxing standards, is that something the LA County Board of Soups should look at? Is maybe relaxing more standards in Antelope Valley than in the more urban, denser areas?
Yeah, I think there's going to be. It's a good question. I think I agree with you. We are different, and our geography is different, so. At the same time, if you look at public health things, we do have a number of public health demographics in terms of disease prevalence for things which are risky, like diabetes, smoking, and being overweight that actually hurt us a bit, on the other hand. So we've done really well with this, and I applaud the residents of the Antelope Valley and Victorville and down to Santa Clarita. We've done super well. I think when we think about opening up, we're going to probably have overall public health recommendations and guidance about what to do and what not to do. And then within that, we'll have some individual choices to make as well. And that has to do with our own risk tolerance. And I think people will know, based on taking on personal responsibility, do I have somebody in my house who's at high risk? That if I go out and do certain things, it'll put them at risk. Am I one of those people that's at high risk? Or am I in a low-risk category and I have nobody in my household who's high risk, or nobody I can put at risk? So those are going to be individual decisions, and then there's going to be overall guidance, which I think is going to be blanket probably for the county and probably somewhat for the state as well, in a more broader sense.
Okay, great. Thank you for that. So I'm going to go back to you, Dr. Girion, and I probably should have asked this one last time because we talked about talking to your children, but how can you tell if your children are struggling from depression and or anxiety?
Well, here's some behaviors that you can watch for, I think, in terms of, are your children at risk? First of all, be on the alert for increased irritability or crying. And then some of these behaviors Ray Charles can see. It's pretty obvious, and some of them are less. They're more subtle. You have to look at children returning to behaviors that they've outgrown. In other words, regressive behaviors like toileting accidents or bedwetting. If your child is suddenly preoccupied with excessive worry or sadness, changes in eating or sleeping habits, acting out behaviors, and then difficulty with attention or concentration, avoidance of activities that they used to enjoy but no longer do, unexplained headaches or body pains. A lot of times people will use their body to express emotional concerns. And then with older children, particularly use of alcohol or tobacco or other substance abuse, you need to be aware of those issues. Okay.
So I'm going to follow up on that, I guess from an adult perspective. So we got a question in from John. He said, the COVID virus has changed my life. I'm worried I may lose my business. I'm isolating myself more and drinking and eating more than usual. I'm beginning to wonder if it's worth it. What can I do?
Well, that sounds like a little more concerning call.
Yeah.
For one thing, I would alert people to the possibility of a lot of people have had suicidal thoughts in their lives and they don't act on them. Suicide is a permanent solution to a temporary problem. Anybody who is suicidal will get over being suicidal if they don't kill themselves. I'm not saying that to be funny. I'm saying that that's
right.
It's going And the suicidal mindset is an altered state of consciousness in my mind, because when you get so preoccupied and you're so hyper focused with what it is that you got upset about in the first place, your ability to problem solve begins to shut down, and you get tunnel vision, which we call dichotomous thinking. It's black or white thinking. Either I'm perfect or I don't deserve to live. Either I'm financially solvent or I don't deserve to live. And there are a lot of people who are going to be experiencing some financial hardships here. That doesn't mean that you have to become suicidal over it. If you're at that point in time, first of all, this person sounds like they need some more professional help, and I would seek out professional help. And there's low cost or free care, like with community health agencies, or you can go to the hospital. Antelope Valley Hospital, we have a mental health unit in the emergency room. Just because you go there doesn't mean you'll be hospitalized. About 80% of the people who come to the psychiatric emergency service, they go home. But to be sure, this person is experiencing and struggling with their thoughts, and they need to get some help and some problem-solving solutions.
Okay.
Also, they need to avoid drinking. I'm sorry?
So hopefully, I was going to say, hopefully he's on the call and listening and takes that advice. So you can bill me for this one, because this is my follow-up on his. So when this thing first happened, as I'd already shared, I had a really good friend who passed from COVID, and it really rocked me. And I will admit that first week there was 3 days I didn't take a shower and yada yada. But now I'm kind of in a groove and trying to have a structured life like you recommend. I'm working out every day, but I'm eating way more than I should be, and you cannot outwork your diet. So is my eating boredom, or is it depression? Or if it is boredom, what and I'm sure I'm not the only person, what steps can we take to try to rein that in? I've only had to put on pants twice so far, and both times they were really, really tight.
Well, do you change from your daytime pajamas to your nighttime pajamas?
I do.
Okay, this is a good sign.
Well, I wear sweats during the day.
Yeah, and I the same. So first of all, obviously we need to eat to live rather than live to eat. But a lot of people during this time that I've spoken to, some of their first of all, they have the nibbling method of coping with stress, and it's really understandable. This is another one of those normal reactions to an abnormal situation. But it's also a good idea to get a handle on it a little early, and instead of stress eating, learn to, for example, you can set out your portions of food that are healthy for you, and then learn to enjoy what you eat rather than wolf it down. Take your time to enjoy your food. It's part of what we call mindfulness, which is a whole series of techniques that you can use to cope with this abnormal situation. Being mindful that when you eat, take your time to enjoy what you eat, and take your time to enjoy the smells of what you're eating, and also take your time to plan your meals if you can. Not everybody has the time to do that, but if you can, take your time to plan your meals. You're right about the exercise also. Be very mindful of your need to exercise.
Yep, I definitely agree with that. So we're gonna go back to Dr. Stock now. So we had a question from Suzette, and I don't need to go into the questions now because she has a concern because her husband needs the surgery, and as you know, initially the governor said no elective surgeries. which has been obviously inconvenient for a lot of people, but also an economic burden on hospitals. For your average hospital, 80% of their revenue comes in through elective surgery. So that was actually lifted yesterday. So I'm happy to report to Suzette that, she can get her husband in for that heart procedure that he needs. But kind of implied in her question is it safe to go to the hospital?
A great question. Thank you, Senator. Thank you for the person who asked it. There is we've seen a lot less trauma since this began because people are staying home. They're not doing the things that would create the circumstance where you'd end up in a trauma center. No sports injuries, work-related injuries, and we haven't had so many stab wounds and gunshot wounds either. But it's hard to believe that the same incidence of medical problems don't currently exist that existed the month before coronavirus got here and this whole COVID emergency began. So what's happening is people are scared to come to the hospital. And I understand people are hearing messages from the media 24 hours a day that they're hearing messages from public health also that are saying stay home if you have a cold. If you think you're getting sick, call your doctor. They forgot the last bit of that, which is that if you're having an emergency, if you think you're sick or injured, come to the emergency room. And we haven't told people enough that it is safe to come. We have safe places. Whether you have COVID, we know how to take care of you if you have COVID. But we also have safe places and know how to take care of you if you don't have COVID. And the reality is that a lot of people are suffering in the community, not just here, not just in other parts of the United States, but all over the world, and having serious problems that could be treated, like heart attacks and strokes, appendicitis. They're having these things happen at home, and they're coming in weeks later with complications or days later when interventions to take care of the primary problem have already passed, and now we're taking care of the complications. So, yes, it's safe to come to the hospital. And yes, you won't get COVID if you come to the hospital. We have safe places and clean places for you to be seen. The other thing is delaying things that are serious, while they may be elective at the beginning, can become an emergency later on. So I'm very happy that people are going to be able to come back and get their procedures done. Not everything is getting done elective sounds like it's something you could do or not do, but people have tumors that need to be biopsied. They're worried they have cancer. There's people that need procedures done so that they can function in a healthy fashion. So please, it's important.
Did we lose you, or are you back? Dr. Stock, are you there?
Senator, do you hear me?
Okay, now I do. Okay, you were gone for a second. Maybe it was just me. Okay, well, thank you for that.
Sure.
No, I lost it too. Yeah.
Okay, so here's a question from Kathleen, and I think this is a great question because I think this is a scenario in a lot of families. So her question is this: my 80-year-old mother needs some temporary assistance as she's going to come and live with us. We have 2 young children, and I am, quote, an essential worker, so I am not sheltering in place. How do we keep her safe? Should she stay isolated in a room, and can she interact with us normally?
Mm-hmm. Well, both my parents are 80 years old, and while I don't live with them, my wife and I live down the street, less than a mile from them, and I know what the concerns are. And if you're living in the same household, it's even more of a concern. So how do you do this? Because I'm worried, that I'm going to bring stuff home and get my household family members, COVID virus if I'm not careful. So. The answer is first of all that we all need to realize we have to take care of ourselves and we have to be respectful of others, especially the people we love, our family members, and the people that are high risk, like 80-year-olds. And the way we do that is by following what public health is telling us to do. If you go on the website for LA County Public Health, there's really simple to read, clear-cut stuff to do, what you do at home if you're you have someone who is at high risk, or if you think even if you have a viral infection, and it could be COVID, what you do to protect yourself and protect yourself from other family members. And so the answer is we don't touch each other. The answer, you could still be with each other, but you can't touch each other. You don't get too close. You try and keep that social distance. That person who's at high risk probably should keep to their space, have their own personal space, their own bedroom, where they're going to spend most of their time, especially if you're there and you're someone who's putting them at risk. Or it could be that you come and go, but you're not in the same space at the same time. The person who's going outside of the house should be making sure their body is clean, that their clothes are clean, that they're not bringing stuff in the house. And if they're all concerned, they can even, wear gloves or put plastic bags on their hands when they touch doorknobs and touch things in the house, so that they don't put the rest of the household at risk of people that are sheltering. And we can do this, but we have to. It doesn't feel normal, but it isn't, and it's not normal, but it's what we have to do right now. So don't touch each other. Don't share space. And in fact, in my own household, I wear a mask, in order to make sure that I'm not bringing home virus and getting anyone else infected. And when I go and see my parents, I keep a mask on, and I'm not touching my parents. So those are the kind of things we need to do to keep each other safe.
Dr. Stock, I know that physical distance doesn't mean that we have to have social distancing. And can they be in the same room with an elderly person if everyone's wearing masks and not touching?
Yes, I hate to tell this story, but I will for the sake of the audience. I had my sister just passed away during this period, during this COVID, and was in a terrible car accident, and I had to go through that tragedy in the middle of this crisis with my family, with my elderly parents. We had a funeral during this time, which is not a normal funeral. You can't have social gatherings more than 10 people. And we had 2 meals that we all shared together. And we did it with masks on, except when we were eating. And we kept that social distance, even in something that extreme as a funeral and the grieving process with our family. So I know it can be done. It's not fun. There's nothing normal about it, but it's what we have to do to keep each other healthy right now.
Yeah, sorry to hear about your loss. I did not know that.
Yes.
Thank you.
And then maybe Dr. Girion, you can maybe add on to this. So I had a friend last week who had an unexpected heart attack and died. And of course he died in the operating room, and his family weren't even allowed in the hospital. So I think that's happening a lot. So Dr. Girion, any ideas or strategies to help people deal with a situation like that where you don't have closure because you can't even get in the hospital?
Well, again, a lot of that is that the physical distancing doesn't mean we have to have social distancing. I would try to pair up with people who you share the loss with, either through Skype or Zoom. We've got all sorts of technology now with FaceTime, Twitter, texting, even writing letters to people who have co-experienced the loss with you, telephone, but reach out and make sure that you stay as connected as you can. With elderly people now, try to keep them feeling connected to you also. But if you've lost somebody, stay in contact with the people who share the loss with you as much as possible, and just be respectful. Pain and loss have to be respected, and it's kind of cumulative to all of the other losses that we are experiencing with this COVID virus. So be aware of that and give it time. Be patient with yourself. Don't expect yourself to handle everything immediately. Give it some time. I kind of have myself like a time payment plan, like you pay off a car. When I've experienced multiple losses, I take my time and deal with emotional bits of information or process emotional bits step by step. I do the possible over time.
Okay. And you kind of touched on this earlier, but we had a question. I don't, again, we've got callers, across the district, so I don't know if you're as familiar with San Bernardino County as you might be with LA County. But got a question from Maggie in terms of, will there be any no or low-cost assistance for individuals seeking stress counseling? So whether it's workshops, online, in person, et cetera.
Yes, there is. First of all, just about all communities have a community health system. Here, locally in Antelope Valley, we have Bart's Altadena, and they have very low cost or no cost help for just about any health care concern, including mental health.
Okay, very good. So, do you have more, Dr. Girion?
No, I think I provided the phone number for Bart's Altadena if you need it.
Okay, great. So, Dr. Stock, this is a question from Carlos in Victorville. What's the difference between COVID-19 and previous flus that we've had? And and then a follow-up is: do you believe that COVID was in the country sooner than what we've been told in terms of just being here last month?
Okay, so we've been told. We're finding out by being able to trace people who are having lab work done and autopsies that it certainly was sooner than we were originally thought. It was here at least in early February. And it certainly could have been here before that. We just don't have any evidence of that yet. But when we start seeing these cases, this is the end result of people probably with asymptomatic incubation period is what I should say, for a period of time before they start having symptoms. So the earliest we've heard now is early February. As far as this and the flu, so there's separate viruses, right? One's the influenza virus, which was what did the pandemic in 1918, and what we have flu seasonally, and people have been talking about, other pandemics. So this is the last giant pandemic we've had since 1980. It's a bit best comparison, although we've had others, and 2009 and other times we had SARS. And so when you think about this virus, this COVID virus, there are other coronaviruses out. There's the common cold viruses are coronaviruses, many of them, and then the SARS virus from the SARS epidemic, and the MERS epidemic, the MERS virus. So those are all in the same family. They're cousins. And those we can look and learn from those things. So what may be interesting about this is whether or not this becomes seasonal or not. We just don't know, and we don't know if the antibodies that are being formed by people that are sick are they going to be protective? Meaning, does it keep you from getting the illness again? And how long do they last? They last a lifetime. Do they last 1 year? And we're learning all those things right now. There's promise to believe that when you're sick and you form antibodies, or hopefully if we form a vaccine, we form antibodies, that it'll at least last one season. And the reason we believe that is some people are getting what's called convalescent serum. So they're taking plasma from people that have been very sick and have recovered, and find that they have antibodies, and they've given those antibodies to people that are still very sick, and many of them are recovering. And that has happened with other diseases in the past. I worked with Ebola before we had a treatment for Ebola and a vaccine for Ebola. And so there's reasons to believe that antibodies may well be protective in most people, at least for this year, and will buy us enough time to get to a vaccine.
Yeah, I think I mentioned in the beginning that I had a good friend in San Diego that had this and was actually hospitalized. Him and his wife both contracted it. He was hospitalized. She got ill for a little bit, but recovered pretty quickly. So it turns out when they checked for antibodies, not only did they have COVID, but they had SARS, and they didn't even know that they had SARS. And so the CDC has been visiting him and his wife on a regular basis, extracting blood for more research. I thought that was really, really interesting.
Yeah. Once you start looking, you find stuff sometimes.
Yeah. So here's another question for you. So is COVID-19 more infectious when someone is asymptomatic or once he or she has symptoms?
Okay. That's a good question. So So part of this is we think about a viral load, meaning how much virus does somebody have, and then how contagious are they? How easily can somebody else get the illness from someone else? So you probably have your highest viral load probably when you're very, very sick, and meaning you're already sort of sick enough to be in the ICU, and you might be be on a ventilator, and so that's a very high risk time. And I think if you're sick enough to be in the hospital, you probably have a pretty high viral load, and this is probably why when healthcare workers actually get sick at work, they actually get really sick, even though they may otherwise be healthy and perhaps could be quite young, because they get a large load all at once, because there's some breach in PPE somehow. If you get in the community, you'll probably tend to get a lower load than someone gets it in the hospital, if through a different type of contact. And as far as being contagious, there is a study that was in the journal Nature, which is one of the world's great science journals, that showed that probably a day or two before you develop symptoms, you might be quite contagious. And that's the reason for the most recent policy that we all wear masks when we go out.
Okay, great. Hey, so this just popped into my brain right now. For a while there, they said wearing masks was actually detrimental, and then they did a 180. Do you know the backstory on that?
Yeah, I think I'm not sure why they said not to do it before, but clearly the reason to do it at this point, I think they were worried that people might contaminate themselves somehow. I'm not really certain what that is. The simple mask has always been to protect other people from you if you're sick. And whereas the masks we wear at work, these N95s are to protect me from you, because I'm dealing with people all over the place who could have it. So those are the two purposes of the mask. And the idea of wearing it all the time goes back to this thing about the asymptomatic spreader. That somebody who looks well, who might either get sick in a couple of days or may never get sick, could be a danger. And you may be that person. You just don't know it. So if everyone wears a mask, then everybody's protected.
Okay, great. So, Dr. Girion, got a question for you. And actually, I've heard similar scenarios from a lot of people, so I think this is pretty common. So this is from George. So things are tense in my house. My spouse is a teacher and trying to teach her class from home. I'm working from home and worried about losing my job. On top of that, we're supposed to be helping our two kids with distance learning. We're all fighting, and it is miserable at home. What can we do to make this better? Are we alone?
Well, first of all, you're not alone. I think many, many families are dealing with this, where both parents work, and the children are suddenly at home. The parents are at home most of the time, and so you're stuck together. So the first thing to realize is that the parents need to work together so that they can each have time to schedule or fulfill their own work or professional roles. That obviously, it's a prioritization issue. They have to make a plan for distance learning for the children, or adolescents. And they have to plan for time for themselves and time for the family. And what I mean by that is you can plan in time for family meetings. And in the meetings, your regular family meetings are very helpful to schedule priorities, or even take the time to honor your feelings, to talk about how you're coping with this, and to stay connected with each other, or even pray if you're a praying family. Do this on a regular basis. The other thing is that everybody needs their own time space, their own physical space, their own emotional space. And so instead of reacting, proactively plan for each of these family functions or individuals' functions. That's very, very helpful. And it helps you not feel like you're constantly reacting.
Okay. Well, I mean, I think you'd agree with me that this sheltering in place takes the toll mentally. And I'm just curious if you've seen any data in terms if there's been a spike in domestic violence and or suicide. In terms of child abuse, I was reading, I think, in the LA Times yesterday, that actually it's down. It's probably up, but it's down because kids aren't going to school or other places where mandatory reporters are not reporting to the authorities. Have you seen data on these issues and what's going on?
Yes, I have. Yes. In Los Angeles County, if you compare the statistics from today with the same time last year, domestic violence calls are up 8% in Los Angeles County. Now, to show you how socioeconomic strata don't shelter you from domestic violence, the Orange County per capita income is much higher than generally in LA, and their domestic violence calls are up 25% compared to this time last year. So that's something to be very mindful of. And then it's also important to realize that you can have domestic violence with elder abuse. That's another factor of it. And so if you find yourself at home and you're cooped up and you find yourself anxious or antsy, it's a good idea there's no law about taking a walk or getting physical exercise. Physical exercise helps dissipate out a lot of adrenaline that builds up in our system. Okay? It also builds up our immunity. If you exercise a half an hour a day, you're going to build up your immunity. It helps strengthen our immune system, and it also dissipates out some of the buildup of adrenaline, which then metabolizes down to a depressive or anxious-causing chemical in our body, to put it simply. So pace yourself and take whatever breaks you need to so that you don't blow up at somebody. And be aware of your early distant warning systems. If you find yourself being irritable or you pop off at somebody, start taking some breaks outside the house or in your own space in the home.
Okay, great. Thank you. So, Dr. Stock, and I don't know if you can answer this or not, because it's about Ventura County, and I don't represent Ventura County, so I don't know how it got in here. But the question is this: how is it all local counties show regular increases of COVID-19 except Ventura County? So when they're getting sick, or are they not testing as many people? Seems odd that there are commuters that work in LA yet they're not exposed. Have you seen any of that data? Because I'm not familiar with it at all.
I'm really not, but I would say that a lot of the stuff is probably testing artifact. If we could test everyone universally, in my ideal world, I would test everybody in California. I would know your clinical history. Have you been sick, since the first of the year, with a respiratory illness? Have you recovered? Are you still in the middle of it? I would know your PCR virus status, and I know your antibody status, and not me. I mean, I want you to know this stuff, and I want your doctor to know this stuff, and then we could figure out what to do with everyone. So when I see the numbers go up and we see the United States has all these cases, it may be that we're doing a lot more testing than other countries have as well. The numbers a little more solid are the number of hospitalizations that are presumed for COVID and the number of deaths that are attributed to COVID, and even all those aren't 100%, but they're a number of ICU admissions. So of it is a measurement thing. I'm sure there are really cases in Ventura County. I don't think they've gotten away scot-free.
Yeah, I'm sure you're correct. So we got a question from Jennifer from Hesperia. When will a vaccine be available? So there are people that were working on these sort of things before this started, and they're pretty far along. But people are saying, even with that, it has you have to go through these different phases of testing a vaccine to make sure it's safe, and then secondly, is it effective? And they're trying to do those phase 1 type trials, I think, right now, and then they have to move on to the phase 2 trials to see if it's, and then they actually have, if they think it's both safe and effective, they have to mass produce it. All right, so those are the 3 sort of phases. So what experts are saying is it's going to be at least 18 months before we have something in the pipeline.
and maybe it'll be a little faster than that, we would hope. But, there's diseases we don't have any vaccine for. We don't have a vaccine for HIV, right? That's a virus. The vaccine we have for the flu only lasts 1 year. And then we have vaccines that last a lifetime. For instance, the measles vaccine, you get maybe one booster. You get vaccinated as a child, and you get one booster sometime during your lifetime, perhaps. But basically, it's a lifelong immunity. So there's a lot of unknowns right now.
Do you expect so since it's going to be 18 months at the minimum before we have a vaccine? What do you think are the chances of having a second surge later in the year? And what do you do if you do?
So what is with the flu? If you look at the influenza pandemic of 1918, there was a second surge, and the cities that sort of got by the original surge and then sort of just completely opened up, had a real bad time during the second surge. And the ones that were more conservative did not, the ones that kept their public health elements going. So this is why I'm sort of talking about a middle road approach. I think we can open up with, ideally we'd all be vaccinated and we'd be done. It'd be great. But we don't have that. So we're in this really tough period of time. How do we balance all the things out? Meaning, how do we balance out not dying from the virus, not overwhelming our hospitals, not dying from other diseases, and not suffering from poverty and being out of work and bringing our economy to a standstill? We got to find a sweet spot somewhere in the middle, and there probably is a sweet spot, but we got to do it in a controlled fashion. We all have to kind of do it together, and then there will be room for individual variation based on your risk tolerance. But I think we're going to have to keep some of these elements going until we do have a vaccine, and we can all get vaccinated. That's going to be, because we already know our antibody status, even with everything that's happened so far, is only is maybe 2 to 4% in California right now. It's not super high. It's not 80 to 90% where we need to be for herd immunity. So we're going to have to be smart about this.
And, one way to build immunity is with your diet and regular healthy activity, regular sleep, don't smoke, avoid excessive alcohol. But what our diet, food is a drug, and what we eat can help us build immunity by eating nutrient dense antioxidant rich plant foods, eat rainbow colored fruits and vegetables. By having a good immune system, it can help us greatly.
Yeah, and that's a good point, Roger. Senator, I'd like to bring out one thing that probably has been talked about, and some of folks here may be thinking about. When we were younger, before there was a chickenpox virus, we used to go to chickenpox parties, and kids would get, if one kid had chickenpox, all the other kids went to play with them because your parents wanted you to get the disease and get it out of the way. So people throughout human history, have gotten natural immunity when the consequences of getting the disease were not lethal and were not permanent, in terms of organ damage or disability. So the data that's coming out, and there are people, if you listen to some of the people from Stanford, like John Ioannidis, I think his name is, they are advocating this sort of approach that for people that are low risk of having bad consequences if they catch the disease, and if we're trying to get to herd immunity, it may be that letting people go about their business, and if they happen to get it, they'll probably be okay with it, is one line of thought. And that's something to consider, as we think about what's going to happen between now and when we have a vaccine. And there's a lot of people who don't agree with that position either, but I think it's worth discussing.
Okay, great. Thank you for sharing that. Yeah, I went to a chickenpox party. I remember it vividly.
So do I.
We just kind of showed our age, right? We're kind of coming up on the hour mark, and we promised everybody an hour. So what I thought I would do, we'll go with Dr. Girion first, and then Dr. Stock. If there's anything that we missed that you would like to convey to our listeners before we close up, I'll open the floor to you guys.
Well, I would say never let what you cannot do stop you from doing what you can do. So focus on the things that you can control. When you're looking at, for example, okay, you have forced quarantine at home. Look at the positive sides of that you get an opportunity to spend time with your family that you don't normally have an abundance of, that you have time for reading. If you have time for reading, you can read the books you haven't ever had a chance to do. You can take more control over your exercise schedule. There's a lot of positive aspects. The Chinese word for crisis is really two words. The first word is danger, and the second word is opportunity. Certainly, we perceive the danger in this COVID virus, but we're not focusing on the positive aspects of the opportunities that come out of it. First of all, we have all kinds of innovative thinking going on in the world right now, which is wonderful, but we can become innovative in terms of family relationships and what we can do there. So focus on the positive aspects and focus on the fact that this isn't going to last forever. The COVID virus will run its course, and we will slowly get back to normal. I also want to say, step by step, do the possible instead of putting everything on you all at once. When we are recovering, there's going to be staggered recovery. Restaurants are going to have half the people in there that they used to have in terms of spacing between tables and things like that. We're going to have to take our time to recover.
Okay, great. Dr. Stock, anything you want to add?
Sure. A couple quick things. One is, as soon as there's widespread testing available, we should all try and get our test results so we know where we're at. We want to know if we have the virus, if we need to isolate, if we need to quarantine our close contacts. We'd also like to know if we have antibodies, because that could be a passport back to work and back to school. I know the kids may not want to hear that, but it's still be good to know that you're protected, most likely. The other thing is, don't have your emergencies at home. I dubbed a term called corona or COVID collateral damage syndrome. You don't need to be scared. Come in, let us help you. We don't want you to get hurt at home if you're having an emergency. That's what the emergency room's for. I know people are scared. There's good reason, and it's understandable, but please don't be scared to come in letting us help you, because some things are time dependent, and when the time's, we can help you if you come in on time, and we're ready to help people.
Great. Thank you. Thank you so much for that. So, again, I want to thank Dr. Girion and Dr. Stock for taking this time with us. I personally learned a lot. I thought it was interesting. I hope everybody else did. I want to encourage everybody to follow me on social media. My website, which is www.senate.ca.gov/Wilk, WILK, for more information and resources on COVID-19. You can also visit the state of California's COVID-19 website at www.covid19.ca.gov, and there's just a ton of resources there. If you need assistance with any state agencies, please contact us. We have a satellite office in Santa Clarita that's run by Chris Huff, a satellite office in the Victorville City Hall that's run by Rebecca Tennyson. Our main district office is in Lancaster, and the phone number there is 661 area code 729-6232. I'll give that to you one more time, 661-729-6232. We're all there to serve, but we have an incredibly talented caseworker in our Lancaster office, Christine Ward. She's been doing this for 18 years at both the state and federal level, and there's nothing that she cannot accomplish. She's just a phenomenal person. You can also reach me via email at senator.wilk, W-I-L-K, @senate.ca.gov. With that, we're concluding our town hall. Really appreciate everybody participating. I hope that you found this informative. If you have any ideas for other topics that you would like us to bring in professionals on, please go ahead and email me at senator.wilk@senate.ca.gov, and we'll look to doing more teletown halls. Again, Dr. Girion, Stock, thank you so much. And
thanks for having us.
Adieu. All right, take care.